Assalamu alaikum wa rahmatullah. We will continue with this session, which is about elderly in community health sessions. So we'll define elderly and also geriatric nursing. So elderly, it means those who are, or gerontology nursing, it means that gerontology is the study of old age and aging. So gerontology, the study of age and aging, and genetic nursing, it means the science concerned with the disease of old age. Elderly, those who are more than 65 years old, they are considered as elderly. So the aging process is there, and when they are reaching 65 years old and above, they are considered as elderly or geriatric, and they need special care. Major health concern of aging population: the elder in the community and elder in the family. So we are dealing with those in their family and in the community. Elder as individual. So we'll take the elder person in the community as a whole. We have to consider them as a family member, and we have to consider the elderly as an individual. So in the community, some culture view the elderly people are considered as the wisdom with a high esteem. In some, they are viewed as loss of production, so they are unable to produce, with the subsequent loss of status of stigmatism. So sometimes younger people have negative beliefs about the older people. For example, elder may be viewed as too old for surgical procedure, even though they are most of tolerated the surgery well. So even if they are able to tolerate and their body can tolerate surgery, they consider that surgery is cannot be done for them because they are getting old, and what's the benefit of doing this surgery on them? So community health nursing role. Community health nurse help the family to maintain positive attitude toward aging and assist the older people to enjoy their longevity of life experience. So to enjoy we have to help them to enjoy their life, and we have to help the family to look positively to those aging group and to help them. Elder in the family. So community health nursing help the family maintain positive attitude toward aging and assist elder to enjoy their longevity and life experience. As we said, aging families are associated as bear their structure, function, and developmental and all other attributes are there. The structural approach can be done by family genogram, which include 3 generations, to see if the family is because in certain family they are living too longer. The nurses can use this genogram to know more about the family members, their beliefs also, their values, relationship together, attitudes. She can also plan and organize support system for the needy and the demanding older if they are having an older person. Family genogram grandparents, grandmom, then under them the detail of their their brothers, their sons and their nephews. By that, the relationship between them. So, and their age, how much they live. The functional approach is described by activities of meeting the sexual, economical, reproductive, and educational need of aging family members. So all that approach should be maintained. The nurse examine the aging family functional task. This help her to assess their involvement within their older person. So they will check the need for the demand for the older person for the care, and who is the caregiver, how they can provide the care for them. The developmental approach, which is emphasize the synchronization of several dimensions of time, individual time and family time, historical timing also. So by that, to involve them in the free time for taking care of the older person. The family caregiver, in family caregiver, mainly grandparents are raising their grandchildren. Mostly female are the caregiver, in which most of them are worker. So it depends upon the family, and it depends upon the family members. Are they all of them worker, or some of them they are housewife or working within a family also. It depends upon number of the family members and who can take care of that old person during the daytime. Caregiver assist in daily activities of living, daily living, so they can help the client to do his activities of living. Also, respite care, temporary relief of caregiving for caregiver. So we can, the community nurses, they can also, or the family members, they can divide also the role between them in order to give and manage the needed care for their older client. Community health nurse take a major role in respite of care in the taking care of the client, depending on the especially medical care for that patient. Elder abuse, expectation, and negligence. In some families or in some communities, the older person can be abused or can be neglected. The abuse, it means the physical or sexual slapping, sometimes pushing, restraining, or molesting the old client. Sometimes they restrict him from going outside, because especially if he is having dementia, if he is having change in behavior, sometimes they are feeling shy to send him out of the house. Because of that, they restrict his movement and they prevent him from going outside of their house. Psychological threat and intimidation, so they might threaten them, if you are doing so and so, we will do. So punishment will be there. Explanation exploitation, so misappropriation of funds or properties. So they can use sometimes their properties and they can misuse it, they can take it from them. Medical abuse, withholding necessary medication and treatment or assertive device, assistive device. So sometimes also the family member or the caregiver will withhold some of the medication and he did not give the necessary medication to that client. It might be for the purpose that they want to get rid of that client in another way by not giving them their medication, not taking care of them, not giving them sometimes their food. Negligence also, it might be passive or active or self-negligence. Sometimes the client themselves, they are neglecting themselves, they are not taking care of themselves, even though they are able to take care of themselves. It might be also active that they are the caregiver are not giving the care to their client or the relative. They are not giving the care to their relative. Nursing role to prevent the abuse of the older person. So primarily prevention, there are primary prevention goals and secondary prevention goals for that. So the primary prevention, we have to support the caregiver and prevent the potential for abuse. So if the caregiver is taking some kind of support, sometimes this kind of support, it will enhance him to take care properly for their older client, older family member. The secondary one, early cases finding of abuse. So we have to scan, we have to diagnose if abuse are there. So early scanning and finding of abuse situation and the crisis intervention, referrals for those cases, and follow up with elderly and family caregiver. So to role on in order for a prevention, the primary is to support the caregiver when he is taking care of their family member, the older family member. By that support, it will help him to sustain the care for that client. The secondary thing, we have to early diagnosis and find out if abuse is there, and in order to refer those cases either to hospitals or to geriatric home or geriatric hospitals for their care. So you have to review also your books in page 865 for the details of that. Demography of older people. So the aging population, significantly they are growing. So they are significant growing of the aging community due to the development of healthcare also and the healthcare facilities. It is also difficult for them to access the healthcare system if they are alone. So there are difficulty for those older people to get a healthcare because the accessibility, and they want someone to help them to access the healthcare. Mostly elderly population live in a rural area and they are very old, poor, and have more chronic illnesses, combined by a greater problem with access, transportation, inadequate healthcare facilities in that community or in that site. When they are sick, family member refuse to give up where the elderly people believe the only cure for old age is the death. So sometimes they are feeling that the only solution for that care, that they are going toward the end and they are going toward death. The Healthy People 2010 objective for all older adult there is substance abuse, environmental also quality and assistance of healthcare, physical activity, obesity and overweight. Some are some of the the problems of the old age, tobacco use also, and mental health assessment and mental health changes, injury and violence. They might be prone to injury and violence also, immunization, because their immunity it will be declined. So the immunity of older age will be declined. The older as individual, the goal is to maximize the independence and to maintain the dependence on themselves. So we have to maintain their dependence if they are dependent, and we have to maximize their ability to care for their self, because by that we are keeping them more active. Focus on promotion of health and primarily prevention to maintain autonomy of those persons. Also, functional ability depends on individual characteristic and setting, and the environment around him. Is it helpful environment for taking care of himself and support or not? Help them to cope by assessment and facilitating changes. So they are having a lot of changes, in physical changes, that we have to facilitate their ability to deal with that changes. They may exhibit also multiple health problems with complex interaction, which require interdisciplinary collaboration and care. So sometimes the family by itself and family member, they cannot they cannot maintain the care for those clients. They need some support. The support also, it might not be only from Ministry of Health and from the healthcare system. It might be from other ministry also, like the Ministry of Social Welfare and other community association within that community that might be helping them. Chronic illness, they found that around 85% of elderly people have at least one chronic illness, like diabetes, hypertension, or chronic obstructive pulmonary disease, or some of them. Joint condition, rheumatoid arthritis. So 30% have 3 or more conditions. So 30% of those elderly people are having 3 conditions, like diabetes and arthritis and hypertension together. 20% of them dependent at least for one activities of daily living. So 20% of those clients, they are dependent, they need someone to help them or to do the in daily activities of living. Common problems are hypertension, atherosclerosis, and dementia. Those problems are mostly because of unhealthy lifestyle choices like smoking, obesity, sedentary life, and poor adaptation to stress. So those problems arise from that changes. Causes of morbidity and mortality, you have to refer to page to table 35 2 on page 867 in your textbook, and for more information. A question that you have to consider in causing of mortality. You have to find the answer for this question. What is the most common morbid condition in the elderly people? And what is the common cause of morbidity in the elderly? What are the risk factors for those illnesses? In order to find out, when you are finding those answers, in order to find out how we can prevent or how we can minimize the effect of those conditions, and what kind of care that can be provided for those people. Assessment of older client, we have to assess them in generally. Under assessment, we have to assess, as we are assessing other client, physically, assess the area of most affect functional ability. Example, most of them, they are having troubles with the senses, with vision, with hearing, with their strength and physical ability. Those also, it will increase their possibility for accident. They will be more prone for accident and more prone for injury. The functional assessment, you have to assess the individual ability for self-care and doing activities of living, and what kind of thing that he is that they are able to do it, and what kind of thing that they need some help for completing that activity, and what kind of activity that they are completely dependent on other in order to do that activities of living. The mental assessment, it focuses on their mood and their memory. Do they have dementia? Do they have change in their mood? The social and the socio-environmental assessment, you have to assess the family and living situation of that family, the support system for that family, and the financial state and the environmental hazard of that within the family and the house and the area that they are living, in order also to find out how we can help and support that family to get a better care and to give a better care for their client. The psychosocial aspect of aging, coping with retirement, also mostly in most of the country, retirement age is 60. In some country, they are raising it to 65. In some country, also there are early retirement, which might be around 50 years old or less. In this case, also, when the person is sitting without job, without doing anything, also this will create many problems sometimes for the family, because they don't have something to do. Sometimes it might be helpful if they are using their time positively, and some of them, they are doing some other work within their home, within the garden of their home, so it depends upon the activities that they are planning. So they have to manage their time, and also the relationship and the relationship with others. Some aging person, because sometimes they might lose their friend, most of their friends who are the same age maybe died, or they are unable to meet them due to illness. Also, this is sometimes it will limit their relationship with others. So we have to concentrate on relationship with the family members and other, maintaining self-esteem of those clients, coping with loss and grief. So we have to maintain their ability to maintain loss, coping with loss and grief. Sometimes even those people, they are losing some of their children or grandchildren while they are still alive, and this might have a very bad effect on them. Abuse of the elderly also, we have to prevent it. So prevention of healthcare issues of the elderly. Sensory integrity, we have to maintain the sensory integrity. We have to maintain the nutrition, we have to keep a good nutrition and good time of sleep. The client in older age, sometimes they are having difficulty to initiate sleep, or sometimes they are waking up very early in the morning. Also, the ability to elimination, mobility and communication, also cognition and the affect, employment and retirement, also thermal regulation and skin integrity, especially if they are having some chronic diseases like diabetes. So we have to prevent the diabetic food and all of those things. Comfort and spirituality also, we have to maintain it and to deal with that. Special health consideration in caring of elderly, the immunization, their immune system will be declined due to loss of changes in the immune system, and also the level of antibody will be declined due to other diseases, like if they are having diabetes or hormonal disturbances. Also, all of these, it will interfere with the immunization and immunity. The medication that they are using, most of those who are over 65 years old, at least they are using medication for one medication or more. Some of them, they will come with a big bags of medication. Sometimes also they might going around from physician to physician for private clinic, and not only to the governmental clinic. So they are trying to get care from many sides, and everyone is giving them a certain medication. That medication, it might be the same medication but from another company, so they might get confused sometimes, and they might get more than one more than the dose, because it is given from more than one physician, and in this case it might lead also to toxicity. We have to consider that, and we have to check the bag of those older people, the bags that they have for their medication, in order to see if there is repetition of some medication there. We have to consider this point. Chemical also addiction. Some of them, they are might be smoker, and some of them they might addict to, fortunately in our community, those conditions, it is very low. It might be use of alcohols in some client. Ethical also dilemmas, which is the in dealing with those clients. So, special elder health issues. The immunization, as we should said, elderly are at the more risk for developing pneumonia and influenza are leading causes of death in USA. Because of that, for old people, they are giving them immunization for influenza, the seasonal immunization. For elderly, immunization is common for influenza, pneumococcal, for tetanus, diphtheria, as zoster virus, and herpes zoster. If planning to travel, specific vaccination to be taken for health from the healthcare center. The medication, older are more risk for drug interaction and side effect of toxicity, because as we said, aging affects the absorption of the medication. Also the distribution and metabolism and elimination of the pharmacological action. So it might get a cumulative effect also. So it is not necessary that they might take a higher dose from the medication. They might have taken the regular dose, but due to delayed metabolism of that medication or delay in the excretion of that medication, there will be a cumulative effect and it will give a toxic effect. Problem related to poor adherence can also be due to overdose or underuse or misuse, and it will lead to hospitalization. So sometimes the client, they are not adhere to the drug regimes, and they are not taking their drug and on time. Sometimes they might forget to take the medication. Sometimes they might think that they did not take their medication, so they might take take another dose of that medication. All of those things, or they will miss the medication, either if they are taking more or if they are not taking the medication. In this case, it might lead to aggravation of their condition, and it will end them with hospitalization. Therefore, the community health nurse must be attentive to errors, and she have to refer back and to assess what kind of medication that they are taking, and to review every visit. She has to review what medication that they are taking, why this medication is accumulated, why they are having shortage of this medication, because they might take overdose. Because of that, the medication is finished before its time. Chemical addiction. Psychoactive chemicals are commonly used with alcohol in community, commonly abused. This is also, as we said, it is rare in our community. Alcoholism affects 10 to 15% of elder. This is in Western country. Other substance like nicotine, caffeine, drugs which can be taken, over-counter drugs that can be taken without prescription. Also, nurse can help to identify those individuals by noting the changes in their behavior, anxiety, memory loss, depression, and confusion. So all of those, it might be a signs of taking some medication. Refer them to healthcare provider, community mental health center, and nurses should also provide continuous support and follow-up care for them. Ethical dilemmas. Frail and demented elder is anorexic, loss of weight, at risk for complication. So, do you insert tube feeding which will prolong his life, or should you leave him to die peacefully? So the client might have anorexia, unable to take, he is losing weight, but unable to take food. But in this case, there are sometimes dilemmas. Do we have to insert nasogastric tube and giving them the feed, or to let them die peacefully? If they are having also difficulty in breathing, and do we have to do tracheostomy for them, or keep them as they are? If they are having recurrently, also they are exposed recurrently to cardiac arrest, do we have to do resuscitation for them, or to leave them without resuscitation and to die peacefully? So all of those, they are ethical dilemma that the family member and the healthcare giver are sometimes get confused on what to do, for those clients. The nursing role: consider reversibility or irreversibility of the condition. Consider also the patient autonomy. Check the advanced directive and ask the family member what he would prefer for their grandfather or for their family member. Support the spiritual integrity of the person with guide of the decision. So we have to support them, and we have to take their own decision. The comprehensive elderly assessment: we have to assess the history of that client, medical examination for them, diagnostic test and scaling, and investigation. If we are going to the here in our healthcare system, there are a group of tests which is done annually or every 6 months for age group, according to the age group, for women over 45, for old person who are over 60, for those who are over 50. So those investigations in order to screen some of the changes and screening some of the diseases that they might have. Diagnostic tests and scaling: so group 1, social condition and nutritional and hygiene. Also socio-economic environmental assessment should be done. Risk for bed sore and many nutritional assessment scaling should be done. Incontinence screening for that client in order to prevent the consequence of problems that associated with incontinence. Group 2, the mental status. We have to modify the mini mental state examination, and you took it in psychiatric or mental health care. Geriatric depression scale, memory continuing test also. Group 3, the mobility condition and the quality of life, activities of daily living, how they are performing them. Instrumental activity of daily living also, what kind of instrument that they need to help them to do their daily living. Time up and go test, also balance and gait test for. The objective of the services provided for elderly is to enhance elderly health care services in the primary health care for elderly people. To enable the primary health care nurse or institution for helping the elderly, and increase the community awareness about the importance of elderly care services and ensure their participation. Health services which are provided to elderly: evaluation for the need of equipment, so they are evaluating their need for equipment. Evaluation requires different medical specialty and other healthcare provider. The first evaluation include a blood, urine sample, and other necessary sample which cannot be done at home. The elderly may need certain procedure which cannot be done at home, like catheterization and nasogastric tube insertion and feeding. Elderly who lost speech or vision or movement also require evaluation and require healthcare provider at their home to be there with them for the 24 hours. Social services which are provided for the elderly, compensatory devices, they are providing them with compensatory devices, aid devices also, and financial and moral assistance, basic social services sometimes, and elderly home services if the family cannot take care, family members that cannot take care of those old clients, so they are in need to be at old people geriatric home or hospital. Community awareness program in Oman, staff and people involved in providing community awareness. There is awareness package, and they are orienting them to that awareness package and what to do for the client. Management of community awareness also, and target population. Get a target population for that care and the target population for that week. Thank you.